your water breaks during pregnancy, it might indicate early signs of labor or a sign of danger. So how will you know when your water breaks? In this video, I'm going to share with you 5 steps to take when your water breaks or leaks at any point in your pregnancy. Stay tuned, okay? Step 1. Confirm if it's actually your water that broke and not just urine or discharge. How do you know it's your water that broke? You have to understand the consistency of the amniotic fluid. The amniotic fluid is usually clear and odorless, and sometimes it can come with a very sweet smell. Unlike urine and discharge, you cannot control the flow of the amniotic fluid. It can come out as a gush or come out as a tickle. But the consistency of the amniotic fluid is very different because it's a little bit dense, so it's very different from your urine or your discharge, so you have to note. And sometimes it can come out with a mixture of blood, or it can come out with a greenish substance. It can mean that the baby has passed meconium in the womb, and that is an emergency. So being sure that it is your amniotic fluid will really help you to take the next step. Now, if you are not sure that it's your amniotic fluid that is flowing, then don't worry. Let us get to step 2. Step 2, note the time and the color of the fluid. Remember, if your pregnancy is around 37 weeks and above, that should show you that it could be that in the next few hours, labor will start. All right, so you have to understand the color and the time that the amniotic fluid flowed. Now, if it is pale yellow, clear and pale yellow, that shows that it is normal. But if it is greenish or brown, if it has this greenish brown color, it means that it has been mixed with meconium, and that is an emergency. Call your healthcare provider immediately. If it is pink, it means that it could be mixed with blood. Also tell your healthcare provider the color of the amniotic fluid. Step 3, do not insert anything into your vagina. Do not, because once your water breaks, you are no longer protected from bacteria. So do not insert anything. Don't put any tampons. Don't put anything at all. The only thing to put in your vagina is your clean sanitary pad. That is the only thing. Do not apply any other thing, because you only expose yourself to infection, and also the baby may be at risk. Step 4, monitor for contraction and your baby movement. This is very important. In some women, immediately their water breaks, contractions will start immediately. While some women, it will take some hours before their contractions will start. So whatever case you find yourself, always make sure that you monitor your baby's movement, all right? It is very, very important. Time your contraction. Know the time it starts, the regularity of the contractions, how close are the intervals of the contraction. This will really help you to know if you're in real labor or in false labor, all right? Please make sure you take note of this. Keep your baby's kick count. Continue counting 10 kicks within 1 hour or 2 hours. Make sure your baby is moving. Make sure that the consistency of the movement of the baby is normal all the while. Whether you're contracting or you're yet to contract, monitor your baby's movement. And if by any chance you have any reduction in movement, or you feel that the baby's movement is not regular, please make sure you report immediately. Do not waste time. Step 5, head to the hospital or call your midwife. This is the best action that any woman that is in her late trimester and her water breaks, this is the best action to take. Head to the hospital or pick up your phone and call your midwife. All right? It is very, very important. If you are full term, 37 weeks plus, and your water breaks, your midwife may want to monitor you. So within 12 to 24 hours, if labor doesn't start, they might induce you or hasten the labor because your water has broken. All right, so make sure you call your midwife as soon as possible. If the contractions have not started, go to the hospital if you notice any of these things. 1, if you notice that the amniotic fluid has a foul smell, please go to the hospital. If the fluid is brown or green in color, it could mean that it is mixed with meconium. Head to the hospital. Okay, if you are preterm, like your pregnancy is below 37 weeks, that is preterm. It could indicate preterm labor. So make sure you head to the hospital. And also, if you feel anything bulging from your vagina, it could mean cord prolapse. If you feel that there's anything bulky around your vagina, please make sure as you're calling, you're telling them exactly how you're feeling. Remember that the safety of your baby depends on your action. So make sure you call or go to the hospital on time. Now, my bonus tip for you mamas is pack your hospital bag on time. Immediately you get to 34 weeks of your pregnancy, make sure that your delivery bag, that bag that you will take to the hospital, make sure that it is ready and waiting, so that immediately your water breaks, labor starts, and contractions are starting, carry your bag and head to the hospital. Have you experienced water breaking or leaking at any point in your pregnancy? Share your experiences in the comment section. If you have a question about this topic, please share it in the comment section. I'll be here to answer you up front. If you found this video helpful, do well to give us a like and subscribe to my YouTube channel. Remember to ask your questions in the comment section. My name is Nurse Nelo. I'm a nurse midwife, and I'm here to share healthy pregnancy and fertility tips for you every other day. All right, I will see you in my next video. Remember to always stay healthy.